I am Dr. Sumit Saha. Today, our topic of discussion is gastroparesis and its association with GERD. Now, we going to our topic. So, what is the gastroparesis? Gastroparesis is also known as stomach paralysis. It is a condition where the nerves and the muscles in the stomach don't work properly. These stop the muscles from moving through the stomach from the small intestines. When this happens, food does not move or digest the way it should. So it slows down the process, the whole digestive process. People with gastroparesis may feel discomfort while digesting food and experience long-lasting problems like low appetite, difficulty getting into nutrition, and the trouble managing the blood sugars also. Sometimes food may stay in the stomach and don't move through completely. So the patients with diabetes, high blood sugar for a long time damages the vagus nerve, which is present in the stomach. And this nerve that consultates the movement of the food through the digestive system. And this results in movement of the food in the stomach. And also this helps the restriction of the movement of the food in the stomach. This is called diabetic gastroparesis. So we know gastroparesis and GERD are connected in many ways. When the food stays in the stomach for a longer time due to gastroparesis, it increases the chances that the food and the acid flow back into the stomach and causing GERD. In addition, due to the accumulation of the food and the liquid in the stomach for a longer time, there is an increase of time between the stomach and the esophagus also. So there is increase in the pressure stomach and esophagus. The amount of food and liquid in the stomach and the volume of the stomach contents that could flow back into the esophagus. So it causes an increase in the stomach acid production. Another important connections between the GERD and gastroparesis is the stomach swelling, which happens when the food takes too long to leave the stomach. And this swelling can cause the lower esophageal sphincters, one type of budgeling, and the muscles at the bottom of the esophagus, which opens let food into the stomach and closes to the prevent the stomach and food from the moving back into the stomach, which remains open and leading to acid reflux. If patient with GERD experiences heartburn along with the other symptoms like feeling very quickly and nausea and vomiting, it could be a sign that it might be a sign of gastroparesis. So there are some simple steps the patient is suffering from GERD and gastroparesis both. They can follow the following management. First, he or she have to drink enough amount of water or fluids, which prevents them from the dehydrations, which follows maybe nausea. For adults, 1500 to 2400 ml per day water is recommended. And he or she should eat meals in small portions, as large meals may difficulty help in the digestions, and frequent small meals like 5 to 6 times meals per day, which helps to easier to digest and would lead to have fewer symptoms like that. He or she eat foods rich in nutrients based on the how his or her body needs to digest. Some patients are there, they have need more solids in the earlier part of the day without any symptoms. So for them, having solid food earlier in the day followed by the lighter or the liquid food at the night may help in the manage their symptoms. If small portions foods and solid foods are unable to improve your symptoms, then we can follow for that type of patient liquid or semi-liquid or semi-solid like digestion of foods. It reduces the intake of foods containing fibers as it slows the process of stomach emptying. These foods can be from the basars in the stomachs. A basar is a mixture, basically, food and fiber containing of the whole days of the food followed by the light and the liquid portions also. And it can block the stomach and does not allow the emptying the stomach contents. Reduce the intake of food containing high amount of fat. Food labels as low fat, no fat, free fat can be eaten as fats which are responsible for slowing the emptying of the stomach contents. Before gulping, the more gulping of the food in can cause the gastroparesis and GERD more and more. So before gulping down your food, chew it very properly. And then similar to the consistency of like mashed food, and then you can make a liquid pure of your food if needed. Sit upright while eating and after finishing the meal. Monitor our blood sugars, monitors our blood sugar and maintains it also can cause the GERD decreases. Avoid consuming the alcohol. That is also affect the emptying of the stomach contents. And exercise regularly also help to improve the symptoms like gastroparesis by increasing the speed of emptying the stomach content. Usually, walking is pneumocondite. You are experiencing symptoms like feeling full like quickly, nausea, vomiting, along with the heartburns and acid reflux, you can consult your doctor. In case you diagnosed with gastroparesis, and this, whatever 8 to 10 points I have told already, you can follow this. Thank you.